So our final recipient is eHealth Africa. And eHealth Africa started up when the Ebola outbreak in West Africa began some years ago. eHealth partnered with the ministries across the region to help scale up Ebola-focused software-based call centers. And the data collected in those call centers provides critical information that allows the different ministries, the different organizations to make a more targeted and effective response to the outbreaks. So with that, I'd love you to welcome Adam Thompson, the Executive Director of eHealth Africa, to the stage.
Great, it's wonderful to be here and to accept the award that we did a couple days ago, and I'm really excited to tell you all about how we've used Elasticsearch in our work at eHealth Africa. This is our menu for today. I'll explain a little bit about how eHealth Africa got started doing our work, what we were doing with the Ebola outbreak in 2014, the call center application, and go through the rest of this menu. I will preface this, I am an Elasticsearch novice. This was our first kind of foray into Elasticsearch, and we're really excited. I've been really excited throughout the last couple of days to learn more and see the future of how we can expand this stuff. eHealth Africa, we're a nonprofit, US nonprofit organization, but the majority of our operations are in West Africa. We focus on building stronger health systems through design and implementation of data-driven solutions that respond to the local needs and provide underserved communities with the tools to lead healthier lives. We started out, my co-founder and I, Evelyn, we started in 2009 working in small clinics in northern Nigeria and looking at how data could better inform public health decision-making and clinical level decision-making in really difficult to work areas where you don't have a lot of connectivity, you don't have a lot of access to data tools and data systems and things like power. And so we went from looking at just the data solutions to kind of having to build an organization that could do end-to-end, that could make sure that we had the infrastructure, that we had the skilled care workers, that we had the power, the water, the equipment, the tools that we needed to make sure that we could deliver healthcare and data solutions end-to-end. We've got about 800 employees now across our 4 West African country offices, the US, and we recently incorporated in Berlin, Germany as well, where we've got a team of technical support there that provide a lot of our data solutions and some of our innovative tools. We organize ourselves across 5 different thematic areas. Health delivery is our kind of bucket for everything that we do in the frontline, last mile healthcare delivery. This involves everything from supply chain work, where we actually take on the delivery of vaccines to thousands and thousands of remote clinics, where we provide data solutions to the health facilities for healthcare workers to get educational material on smartphones and tablets. What I'm going to talk about today is our public health emergency management work, but this kind of grew out of work that we worked on the polio eradication effort in northern Nigeria and built up a capacity to react and respond to public health outbreaks. We also have disease surveillance, laboratory and diagnostics, and nutrition and food security teams as well. The Ebola outbreak, so we at eHealth Africa started working in the Ebola outbreak in Nigeria in late 2014. We were able to mobilize our Nigerian resources and tackle the outbreak soon after it came to Nigeria. Because of that success of kind of getting it under control very quickly, in Nigeria, we were asked to kind of move our infrastructure and move some of our resources and our team to Sierra Leone, Liberia, and Guinea, where the outbreak was really far along, and we really hit the ground behind the virus. We were constantly playing catch up. It was taking 1, sometimes 2 weeks between a suspect case being identified, to getting a laboratory confirmation, to being able to start contact tracing. And when you're doing that in an area at the speed, and with the virus at the speed that Ebola works, we were getting further and further behind all the time. We really needed to identify suspect cases, get them to a place where we could quarantine them, get laboratories to turn around, and then get contact tracing to figure out who they've had contact with over the last several days. We needed that all to happen in a 24-hour cycle. And in order to do that, we really needed visibility. We knew what cases were showing up at the door. Like, people were showing up to the clinics, people were showing up to the hospitals. That's all we saw. That was our picture. So we needed to broaden that picture. We needed to see across the country and across the region what was happening and what are the potential alerts were. So what we decided to do, and we worked with the Ministry of Health in the different countries, and several of the partners, the telecom companies, really stepped up and helped us set up and give access. And what we were able to do is expand these health call lines that had mostly been dormant in the country, and they were reactivated early on in the response, but they were really kind of limited to one or two people on phones writing down stuff mostly on paper, and it still just wasn't. We weren't getting enough information, and we weren't getting that picture, that true picture of the outbreak. So we built a call center application, and we, eHealth Africa, we have our own software team. We do a lot of work with open source tools, implementing open source tools, but we really looked around, and we needed a tool that was going to work, that was going to allow us to record data at a central location with all of these calls coming in from around the country and around the region and in the different countries. And we needed to distribute that data to the district centers, the centers that were spread around the country, where they would get the data, they would respond to the alerts, and then add in their follow-up alerts and the rest of the data. So we needed to build a solution. We came to the idea we had to build this solution using a bunch of open source tools so that we could make that application work. This call center started handling, immediately we opened up and broadened the lines. We started getting thousands and thousands of calls a day. In Sierra Leone, I think we were reaching like 8,000 to 10,000 calls a day. In Guinea, it was something like 15,000 to 20,000 calls every single day. People calling because someone had died in their community, that someone was showing signs of sickness, and people just asking questions because the information just wasn't getting out to everyone in these countries. And so this became their line to get information and to get updates about what was happening with the outbreak in their community and their country. We allowed both community members and healthcare workers to call this line. Healthcare workers, we actually had a dedicated line to. They would get a priority line in case they, so that we could give them information faster. But the community could call directly in and report. And we built up this database of alerts, and we quickly saw that the outbreak was much bigger than what we were seeing showing up to treatment centers. We continue to provide this feedback. Every single person that called this call center, 24 hours later, they got a call back. Hey, you reported a death, you reported a sickness. Did anyone come? Did anyone show up? And if they did show up, did they do these things? And so we created a feedback loop for the actual response themselves so that they could quickly iterate through and improve over the situation. So we went from a 2-week response window down to a 24-hour response window in less than 2 or 3 weeks, just by constantly reiterating and running through this data and making sure that the people that were making these decisions had access to the real-time information. And it really collected information on the entire response. We collected all the details on, if a lab sample of a swab was collected, so we knew to inform the lab to expect X number of samples during a burial. We were able to get information back out so when someone did lose a loved one, we were able to give them alerts. We were able to send them an SMS and give them alerts and say, and give them updates on the status of their family members when they're in the treatment unit, since they weren't allowed to go inside. And connected all the responding agencies, everyone from the military to the US government to all the various NGOs that worked kind of tirelessly across this response. What I think I have next is the video, yes, demo.
eHealth Africa's call center was launched in October 2014 as an Ebola-focused emergency line. It was scaled up from a technically limited universal emergency number within 4 weeks in Sierra Leone. Similar centers were later also set up in Guinea and Liberia. eHealth Africa developed a desktop application that dramatically improved the efficiency of the call center operators. who had previously recorded caller information on paper forms. The easy-to-use application allows for rapid collection of data on each case. It can also be used to send text messages to local medical personnel to inform them of any action that is required. The data is analyzed and visualized on a dashboard. This shows information such as the number of calls taken within a certain time period, the number of open and closed cases, and the diseases or types of death reported. The call center played a crucial role in curbing the Ebola outbreak in 2014 and currently operates as a universal health emergency number in Sierra Leone.
Thanks. So since this is a technology conference, I will go a bit into the technology background of it. And so like I said, we designed an application that could fit into all these different parts of the response. And we really needed to make it work in our environment. So I had to run offline often at times. The synchronization of data kind of would kind of come and go. And so we needed to be able to get people their data and let them work on it offline. And so we were able to kind of distribute this application around. We had a central call center that would be the first point of recording data in most cases, and then that would get distributed, and then all the follow-up information would happen in districts. So we used Angular as the framework and CouchDB, but it was really limited by its kind of primitive indexing and reporting. We stumbled upon Elasticsearch after a bunch of late-night Google queries and realized that it was something that we could try to dramatically improve the way that we were searching our data, because the database was growing so quickly, and we had to constantly rewrite and refactor the organization, the application, because we just had no idea the volume that this response was going to take on. Elasticsearch allowed us to immediately index all the different facets of the call center, and as we were adding new data elements in, because we're adding new parts of the response, we could just quickly update the indexes and get new reports based on the new elements. Kibana let us set up these visualizations and period and kind of snapshot time reports, so that basically every 24 hours our response teams met in the morning, met in the evening, and they'd get the report. They'd get the reports on all the different aspects of the response, both in real time at that time, so they could see a picture, the whole picture of the country for the first time in terms of what was going on. And what's really interesting and what I love about working with open source tools is we quickly realized that some of the mapping features that were built in, that were available in the version of Kibana we're using, didn't support us putting in our own tile layers. And so our own junior software developer, Ibrahim, in Sierra Leone, was able to do his first open source contribution by contributing Kibana and allowing us to import our own tile layers directly into Kibana. And this is in the middle of the response as it's going on, and we're building these tools. And so it was really, really helpful to work with an open source community and get the support that we needed. And like I said, it was all about, responding to public health emergencies like this is all about time. And every minute, every second, every day that goes by where you don't have visibility on the response is time you lose, and it's lives lost. And so the call center application, the data team, all the people in the responding agencies that really hooked into this application and hooked into this data and used the data to drive decision making and to drive Ebola out of these 3 countries. Thank you very much. And so questions, or I think we'll wrap it up. Thanks.
Thank you, Adam. So I just want to again thank all of our recipients. Paul unfortunately had to run. He has a sick dog. But thank you again for presenting, and I hope everyone enjoyed that.